In this video, I explain what obsessive-compulsive disorders are and how they can affect the lives of affected individuals. You will learn about the symptoms and causes, as well as how obsessive-compulsive disorders can be treated. Obsessive-compulsive disorders are a mental illness in which people repeatedly experience unwanted thoughts or actions. These thoughts are called obsessions, and the actions are compulsions. The affected individuals often cannot control having these thoughts or actions. Obsessive-compulsive disorders can strongly influence daily life and limit individuals in many areas of their lives. The causes of obsessive-compulsive disorders are not yet fully understood. It is believed that genetic factors, meaning heredity, may play a role. Childhood experiences or certain stressful events can also trigger or intensify obsessive-compulsive disorders. Another possible cause could be a malfunction in the brain, where certain brain regions do not communicate properly with each other. Obsessions are recurring and distressing thoughts that a person cannot get rid of. These thoughts may, for example, trigger fears or worries, such as the fear of causing harm to someone. Affected individuals know that these thoughts are unrealistic, but they cannot control them. Obsessions can become so intense that they impair the person's daily life. Compulsions are repeated behaviors or actions that a person performs over and over to relieve the obsessions. An example is constant hand washing, because the person believes their hands are dirty or contaminated. These actions provide only short-term relief but do not prevent the obsessions from returning. Compulsions are often very time-consuming and can significantly limit the affected person's everyday life. Obsessive-compulsive disorders can affect people of any age, but they usually begin in adolescence or early adulthood. Both genders are affected, though men often develop symptoms earlier than women. There is also a genetic predisposition, so individuals with a family history of OCD have a higher risk. Stress or traumatic events can also trigger obsessive-compulsive disorders. The treatment of obsessive-compulsive disorders usually includes a combination of talk therapy and medication. A common form of therapy is cognitive behavioral therapy, in which affected individuals learn to better control their obsessions and compulsions. In some cases, medications such as antidepressants are used to alleviate symptoms. Treatment is individual and depends on the severity of the disorder. Cognitive behavioral therapy is a form of therapy that helps people change their patterns of thinking and behavior. In the case of obsessive-compulsive disorders, the goal is to recognize the obsessions and not react to them. Through specific exercises, affected individuals learn to confront their fears and deal with the thoughts differently. This therapy has proven to be very effective in treating obsessive-compulsive disorders. Antidepressants are often prescribed for obsessive-compulsive disorders to help reduce the symptoms. These medications affect the neurotransmitters in the brain that may be responsible for the development of obsessions. They act on the serotonin system and can reduce the frequency and intensity of compulsions. Medications are often used in combination with therapy. There are various strategies for managing obsessive-compulsive disorders in everyday life. One important method is becoming aware that the obsessions are irrational and have no impact on reality. It can also be helpful to regularly take breaks and not give in to the compulsions. Sharing experiences with other affected individuals, or participating in regular therapy sessions, can also provide important support.